welcome back. Mental health is important for each and every one of us.
But until recently, mental health for men and boys hasn't been the priority. So joining us now is Jason Vitello from Denver Public Health, and he's here to shed more light on a very important issue. Thank you for being here.
Thanks for having me.
Yeah, thank you. So what is happening during our upbringing, especially for boys, that might lead to poor mental health as adults?
Unfortunately, a lot of boys are told from a very early age to stop crying before they are given something to cry about, and to man up in the face of adversity. And as a result, a lot of young boys do not learn what's called emotional fluency, or how to experience, let alone express, uncomfortable feelings in a healthy fashion. And as a result, sadly, we see that a lot of our bars and hospital beds and prison cells and cemeteries are full of men and boys that never learned that lesson.
And instead of having a healthy conversation, they very often, and I'm talking generalizing men here, turn to alcohol, drugs, violence. Where is the disconnect? Where does the problem lie?
So, right, instead of learning how to express and experience uncomfortable emotions, men instead, and again, I'm speaking broadly here,
right,
but men in general learn to distract from uncomfortable feelings through the use of substances, sometimes positive activities, but very often through harmful means. They also learn how to push down and suppress their feelings until they can come up in ways that are harmful to themselves and very often to others.
Sure.
So it's really about learning healthier coping mechanisms in a lot of ways. How does talking openly about mental health, especially when we're struggling, help?
For sure. I believe a lot of necessary conversations that might be uncomfortable stop precisely where they ought to begin. Having that conversation and opening up and letting go some of that load you're carrying is kind of the point of therapy in many ways. But also, I think it's notable that for men, while not all men have a hard time doing talk therapy, it's also helpful to just have camaraderie and spend time. And we have an expression within our Let's Talk campaign. You don't have to necessarily have a face-to-face. You can still stand shoulder to shoulder, and there's value in that as well.
Yeah, and just being here, you know, opening up the conversation, letting men especially know that they're in a comfortable environment would help to get them to open up, I'm sure.
Absolutely.
All right. Jason Vitello here from Denver Public Health. Thank you so much for joining us. If you or someone you know is in need of support, please call the Colorado Crisis Services at 1-844-493-TALK, or you can text TALK to 38255, or go to coloradocrisisservices.org to access a live chat available in 17 different languages. Thank you for being here.
Thanks. Also check out letstalkco.org to learn more and get access to other resources.